We are glad you could join us. This is Health and Lifestyle, where we talk all matters health. To interact with us, go to our social media handles at Mariambo at KBC Channel 1 on TV, and on Facebook, it's KBC Channel 1 TV. Welcome to the program. Coming up in this program,
your cut with a razor and a scalpel.
I cannot stand the sight of a razor. Eva shares her experience after FGM.
What we did is now formal clitoroplasty, whereby we found there was a lot of clitoral tissue which was removed, but on further dissection we found a good chunk of the clitoral tissue and brought it down close to the urethra and stitched it to the external skin.
With each stitch, he restores women's dignity. Dr. Adam's cut of healing. And on Good Practice today, we remind you of some of the harmful effects of FGM. Female genital mutilation robs girls and women of their womanhood. In most cases, people see the physical harm caused, but beneath is a psychological and emotional trauma that leaves the victims struggling with their sense of identity. Evangeline shares her journey of healing and finding peace with her mother, the one person she thought should have protected her. Evangeline Mukami was just 11 years when she underwent female genital mutilation, FGM. She recalls being excited to see her grandmother and a bunch of relatives.
My mother was there, a gathering. And you see, from where I came from, we didn't have activities. It was just a school holiday. We didn't have many activities or even visitors coming to visit. We didn't have. So I was like, what is happening? Then within no time now, I realized there was a stranger amongst now my relatives.
The stranger was a nurse called in to perform FGM.
We were told to go and shower. I went, showered, then you go in, innocently. Then you're pinned down. This is the time you realize, damn, as in this is not a joke. As in, everyone is, and for me, I'm a fighter, and I was very stubborn. Then the nurse now came with the injections. This is now what we are calling now the medicalization. That's why I told you medicalization is not a new thing. So after the injection, I still felt the cut even as I was being cut. So you're cut with a razor and a scalpel. So she starts to cut with the razor. Then she said, "Yeah, ikati," in the middle, so I could hear the conversation. So akachukua scalpel. And for me, up to today, I can't hold a razor. I don't want to see even the sight of a scalpel. Now, those are the long-term trauma that people live with. They may not speak about, or they may not even attach it to that. But for me, I know even the fear of injections, I know where that came from. Now I am in touch. I didn't know for a long time. Yeah, then within no time, you're bandaged up, then you're taken to the room, and you're led to heal.
The experience, she says, robbed her of her confidence and childhood too.
It took away my childhood. When you're being reminded, sasa wewe ni mtu mzima, at 11 years old, really you're just a child. You need to go through the normal ucheze. So with time, when I look back, I now was expected to do too much. I had to grow up very fast and, fit into the expectations of the community. If I would play in school, my mother would have people tell her. I would go home, I was beaten, and I became very rebellious. I started having no faith in my mother. I started feeling, as a mother, you ought to have protected me.
Long after undergoing FGM, Eva's journey from mutilated girl to self-confident woman was a long and lonely one.
I realized that I had a growth that was growing. So, of course, I have no one to talk to, I didn't know what to say and who to say. So when I joined campus, the growth was a size of a tangerine. So I did a series of 5 operations. Immediately after a year, 6 months, the growth would just come back. The doctors didn't know it was a cyst, and it was as a result of an infection that happened after FGM.
Another complication she faced was during childbirth.
So I was admitted. So the nurse was checking how far is the baby, what. And the nurse was on my case. She asked me, "Who cut you? Ni nani huyo alikuwa anakufanyia hivi? Na ulikubali kwa nini?" And she said, "Sasa wewe utashindwa kuzaa. Hata mtoto anaweza kufa, hata wewe unaweza." So she put a lot of fear in me. And this is now when it dawned on me that this thing is really bad. And when she left, I found my way and sneaked out the hospital.
In labor?
Yes. I felt I can't deliver there. I probably should leave and say, you know, I started now feeling so fearful. I went to the house in labor. Then in the middle of the night, I was in a lot of pain. My auntie used to be a nurse at Nazareth. So I called my auntie and she said, "You need to come now." So I was admitted. And I went through a CS. Of course, now the doctor explained with the scars, I could not go through a normal delivery, and the baby now was already in distress. But you see now, I felt humanly treated.
FGM is a non-medical procedure with zero health benefits, but it can cause a lot of other complications for women years afterwards. Severe bleeding, difficulty during menstruation and passing urine, and worse still, shock and death. Although Eva was subjected to FGM more than 2 decades ago, she still suffers emotional and psychological consequences.
The other day my son said, in 2021, Mom, something drastically happened in your life. You know, because now I started even being caring, able to listen. Kitambo, I'll just bash people. I was very cruel. Even the team I managed them ruthlessly. You know, because you have this pain that is in you, but you can only project it on other people.
Platinum Surgery Center in the capital, Nairobi. Nothing special, you might think, but their services are in big demand. Over 1,000 women have found a new sense of identity here. With every stitch, Dr. Aden reconstructs the damage caused by FGM.
We expect these people to get back their sense of dignity. The feeling of being complete now is restored. In my studies that I've done in this country, more than 75% feel very complete, feel fulfilled, that their external genitalia looks like the other external genitalia.
Reconstructive surgery has helped women like Eva put behind their trauma.
Before the surgery, I felt like I was just full of scars. You know, I was not even confident about my body. Yeah, but now that was restored. I feel better. I feel I don't have the scars. I feel emotionally I am stable, and mentally I am in a better position.
The United Nations estimates that more than 200 million women have undergone female genital mutilation FGM worldwide, with 3 million more at risk. In Kenya, 4 million girls and women have undergone FGM according to UNICEF. Now, Eva has dedicated her time to help others on that journey.
And currently, I run a virtual safe space for survivors, and we are over 200 of us. For me, is to just uplift other survivors to know that services are available. Whether it's mental health is very key. Trauma is real. Some women went through FGM; they were cut by scissors. You know, in some communities you're cut. Then after 2 days, the circumciser comes and checks if they cut well. And most likely they'll cut you again.
Eva's story is a stark reminder of the trauma that survivors of FGM have to endure.
Kwangu mimi FGM hata kama ni mila ambayo imepitwa na wakati. Saa hii tunaishi kwa ulimwengu ambao umekuwa civilized. So kwa hizi vitu ambazo zinaturudisha nyuma kwa zile mila za mababu, kwanza kufuatilia vitu ambavyo havitusaidii, kwa sababu kwangu mimi, kwa maoni yangu, naona kama FGM hakuna mahali inasaidia kwa kawaida maumbile ya mwanamke ama msichana.
From what I've been hearing and what I've gathered sometimes, I really think FGM, it's really a bad thing. It's really a bad thing. It has led many girls to leave their homes, to run, so that they can feel safe. You know, it's something that inasemekana, once you've undergone that, you might even drop out of school so that you can be forced into early marriages. There are complications, UTIs, bacteria. So it has a lot of consequences. It has a lot of bad things. So I really don't go for it.
FGM as per now sio kitu ya kufati unaongelea as per now. Hiyo kitu inafai kuwe banned totally. Hapa inafai kuwe tu banned totally juu. Inaumiza watoto wetu, inaumiza wasichana wetu, of which kitu hiyo impact inaleta kwao. Kitu kingine madhara iko nao, yani madhara inaleta kwao ni ile ina demoralize seta zao.
FGM, I think it causes psychological trauma mostly to the affected girls. So I don't think it's something that I'd advise them to go through. Counting on the pain that they go through, I'm trying to picture the kind of pain I feel when I undergo my menstrual cycle. Then I'm trying to imagine the pain that they feel when they're having sex with their husband. So I guess it's kind of really painful. So it's really an awful thing.
Hadi set books nilikuwa ninafanya high school kulikuwa na msichana alikuwa anapinga sana FGM kwa sababu ina demoralize mtu. Mimi si mdem, siwezi elewa, mimi si msichana. Lakini according to experiences mnaonaga tu mtu akishafanywa FGM anakuwa demoralized in some sort.
Many women who have undergone FGM consider Dr. Adan Abdullahi a hero. At his Platinum Surgery Center in Nairobi, more than 1,000 women have undergone reconstructive surgery to repair the damage caused by FGM. And since FGM is a sensitive issue, most survivors find it difficult to talk openly. Dr. Adan begins by explaining the case at hand.
So this was a young 25-year-old lady from the northern part of the country. She had type 3 infibulation with clitoridectomy, which was done. And you could see everything was closed. And a big chunk of the clitoris was removed. So we had to do preoperative counseling and then took her to theater right now and removed all the scar tissue. She had thick scar tissues, and of course her urine stream was also being affected because that sort of closed it up, so it was going behind. And we corrected that and of course brought out the remaining clitoris which was inside to the surface near the urethra, and the procedure went well.
So you talked about the different types of FGM. That's the layman's language. Yeah. Maybe you could explain to us the types so that we can understand them very well.
So we have type 1, type 2, type 3. Type 1 is when they have just removed a bit of the clitoris without removing the lips, the labia majora and minora. Now type 2 is removing the clitoris and with removal of partially the lips or not, both the big one or the small one. And then type 2 is A and B. So type 2B is the severe form where they have removed both lips and they have removed the clitoris as well. Now type 3 will be doing all that and now stitching the entire thing and leaving a pinhole at the birth canal. Almost all of them, the main clinical complaint is the feeling of being incomplete as a woman. And that haunts them. From the day they realize that they've been cut, they have it stuck in their head, how the pain is and all that. And then they come and say, I feel incomplete as a woman. And when you further probe with questions, the issue of FGM comes, and that's number one. Number two is for those who are married, because of the thick scar tissues, they have pain during intercourse with their partners. Number three is deviation of the urine stream, like this classical case of today that we performed. had deviation of the urine because the urethra is blocked with a skin because they tried to sort of stitch it.
So what are some of the complications that come? Because now this one is physical. Definitely it has even health complications. But there are also other complications that come with FGM. You could explain to us.
Yeah, so the first one is the type 3, when they have been stitched, have problems in delivery. The baby is not able to come out because it's pinhole, and most of the midwives or the obstetricians will have to open it up for easy exit of the baby. So those are some of the main complications of this thing. Now for the type 3 also, if they have stitched everything and the baby cannot come out, and the baby is stuck at the pelvis, the baby could be stuck there for some time, and you could get necrosis of the wall of the bladder.
So this particular patient, like you've rightly explained, had a type 3 FGM.
Yeah.
Again, I'm putting it in layman's language. What exactly did you do to reconstruct, her case?
So this lady was completely closed. She had a clear type 3 FGM. So we had to go in and initially open it up so that urine stream is normal, natural. After that, what we did is now formal clitoroplasty, whereby we found there was a lot of clitoral tissue which was removed. But on further dissection, we found a good chunk of the clitoral tissue and brought it down close to the urethra and stitched it to the external skin. We hope that that little tissue which is there will be enough to give us some stimulation. The method I did was the Foldes method. We expect 80 to 88% increase in sensitivity and almost 50% increase in orgasm. But more importantly also, we expect these people to get back their sense of dignity. The feeling of being complete now is restored. In my studies that I've done in this country, more than 75% feel very complete, feel fulfilled, that their external genitalia looks like the other external genitalia.
There is also the issue of psychotherapy, which is very important. So you're giving a new lease of life to these patients, but physically they seem to be okay. And that's the mistake that many people, people don't talk about the emotional trauma that these women go through. So how important then is it for somebody who has been a victim? Because for me, those are victims, really. We might say they are survivors, but they've been victims of FGM. So how important is psychotherapy then for them?
Your question is valid. They need that counseling. Most of them have got post-traumatic disorders. They are depressed to a certain extent, but they got used to it. So what we do is we get the counselors to talk to them, debrief them, and we reassure them that all will be done, what we can, to give them a sense of dignity. So the trauma is being counseled, they feel better, we do the surgery. After that, we even do post-operative counseling after that, and they feel better. It's all meant to make them less of a problem up here in the head, yeah.
You had mentioned to me, like, you've done over 1,000, if I'm not wrong, surgeries since the inception, of this clinic to help the women. But what pains you more when these women come to you? What do they tell you? It is coming.
Yeah, what pains me more is that psychological problem they have and the fact that they feel less of a woman. That statement of, I feel less of a woman, cuts across the board. Whether they are Kisis, whether they are Somalis, whether they are Embus, it's almost the same. I feel less. Something is missing in me. And for me, that really hits me hard. But the other one that hits me hard is when a lady tells me that I have been cut and my husband or my partner has said that you have been cut, you're not useful to me. That hurts because it wasn't her fault. She was a baby when she was cut. And these women come and cry and say that he left me because he realized I was cut. I think that's painful. Yeah, I feel for them. Yeah, that hurts more than anything else.
What would you want to tell communities that are still practicing FGM? Or even individuals whom now we know are quite enlightened, they're educated, but they will still come back and, do it or even want to bring their daughters.
My message is there's no benefit of FGM. It has absolutely no benefit. I want you to picture out when you don't have the sense of taste, when you're eating food, when you don't have the sense of vision, you can't see, when you don't have a sense of hearing or a sense of touch, you feel handicapped. The same way, when you don't have a sense of feeling sexually, you're handicapped. You feel very bad. And WHO has put this as, the UN has put this as a human rights violation. And my message is, it has no value at all. Do not let that happen to your daughters. It's a barbaric culture. Let me repeat that for those who think it's cultural. It's barbaric. It has no value at all. And we should fight and ensure that our ladies are not cut. Some ladies, some young girls are cut and bleed to death. You must have heard that in the news. And some of them get infection. So we shouldn't, and we should, prevention is the way forward, not surgery, not what I did today.
FGM has no health benefits, only harm. Some of the immediate complications of FGM can include severe pain, excessive bleeding, fever, infections, urinary problems, shock, and even worst of all, death. Some of the long-term complications can include painful urination, urinary tract infections, menstrual problems, scar tissue and keloid, sexual problems, increased risk of childbirth complications such as the difficulty in delivery, excessive bleeding, cesarean section, and even need to resuscitate the baby, etc. And newborn's death are also some of the complications that can come as a result of FGM. And let's not forget psychological problems, including depression, anxiety, post-traumatic stress disorder, and low self-esteem. Well, we thought we could just remind you some of the harmful, effects of FGM in our good practice today. FGM is a barbaric practice that harms women and girls and must be condemned by all means possible. Well, on that note, we end the program today. My name is Marie Yambo. Remember to interact with us. You can always go to our social media platforms at Marie Yambo, at KBC Channel 1 on X, and Facebook is KBC Channel 1 TV. And don't forget, this particular program is already uploaded on YouTube in case you need to watch it again. And on behalf of everybody who made this program possible, that is Dr. Adan Abdullahi, and also Evangeline for sharing her story and her journey to recovery after FGM, we say thank you. And thank you to you too for taking the time to watch the program. My name is Marie Yambo, and I hope to see you again next time.